Okay, this is week 6 of our onboarding. Today, we're going to go over how to do chin Botox and talk about end of the month things and then stock transfers. And then we have our social media and marketing ideas. So the very first thing I'm going to talk about is chins. So what's really interesting about the chin is I can treat it as I prefer a medium muscle group. I like to do it with a 1-point injection. I know a lot of injectors will do it with a 2-point injection. The reason why I choose to do it with one is because I feel like that I have less of a chance to get diffusion into the DLI. So let's talk about some of the muscles in the chin. So you have the mentalis muscle, and the mentalis muscle, it's kind of shaped like a V, but then the very bottom part of it, this whole kind of thick aspect of that is the mentalis muscle. So that's the muscle that we're going to be treating. However, directly next to the mentalis muscle, you have these two muscles that kind of pull down the lateral oral commissures of your mouth, and that is the DLI. Now, right next to the DLI is the DAO. The depressor anguli oris is responsible for the very lateral aspects of the oral commissures pulling that part down. So we can treat the DAOs. Whenever we are treating the mentalis, we do want to make sure that we stay into the belly of that muscle. So that's the reason why I like to treat it as a medium muscle group. So for Dysport, I'll use like 5 units of Dysport, or if I'm doing Botox, I'll do 2 units of Botox. Now, if I have a patient who I've treated in the past and I did the 1-point injection technique and they still had some movement, then I will just adjust my dose in the future. And then I would just bifurcate that dose and do 5 and 5. So then you're still treating as a medium muscle group, but then you are directly going on either side of the center. And I only do that for patients after I've treated them one time because I want to see how their mentalis is going to respond. Now, there is something that can happen whenever you are treating the mentalis. Oops. And I can show you exactly how you do that. It is called, it will be hyperactive. It's very common after you treat the chin for the very first time. Let's see if it will actually show me. So the very first time you treat it, sometimes that muscle will kind of spasm a little bit.
Good morning.
And what will happen is it will start to kind of bulge out. Now, usually this will go away around that 2-week mark or so. But if in about 3 to 4 days after it starts to happen, I can go back in and just add more toxin to help calm that muscle down. So don't be concerned if you start to kind of get that jetting out. Just go back in with some more toxin and you can retreat it. So we're going to watch this quick video.
Good morning. I'm Dr. Tim Joshin, and welcome to Best of Both Worlds, or Bob W. Today we're here with Katrina, who's one of our consultants, and we also have Brittany, our medical assistant. So today we're going to be talking about what I used to refer to as golf ball chin, and I've been informed that the name has been actually changed to cellulite chin, and some people will also call it orange peel chin. And then there's this other term that's being thrown around, which is chin augmentation. Now, a chin augmentation has nothing to do with what we're going to be doing today. A chin augmentation is actually where you put a prosthetic device underneath the skin to make it enhance it. So today we're talking about cellulite chin, and the reason Katrina is here today is because when she talks, she makes this puckering look on her chin, and she's got such a perfect face. And when I said to her, Katrina, we need to work on your cellulite chin, she was a little bit taken aback. But a lot of people don't know that they're doing it because you don't see it when you look in a mirror, because people do things to make themselves look their best. And one of the things you do naturally is you relax your chin muscles. So this is not cellulite. This is not orange peel. This is actually muscle fibers that are attached directly to the chin. And when you make different facial expressions, they pucker or pull in. Now, we have a really easy treatment, and that treatment is to do one of the neurotoxins, either Botox or Dysport. And today what we're going to be using is we're going to be using Dysport because I like it. It's a simple treatment, and you're going to see just how easy this is. What we do is we take a little alcohol just to clean off the chin, and then what we do is we just take the tiniest amount of Dysport here, and we have a little vibrator to try to make it a little less painful. And then we go right into the midline, excuse me, Garrett, and we put it in all the way down, and then we inject. And boom, it's all done. Now, Katrina's going to start to see a result in about 2 to 3 days. It does take a maximum of 2 weeks for the optimal onset of this product. The side effects are really minimal with this. They include bruising, swelling, and also a little bit of a crooked smile. And so that's very unusual. In the many, many, many years I've been doing this, I don't want to say how many, but it's over 10. I've only ever seen a crooked smile 2 times. So make sure you're going to somebody who has experience doing this because it's an easy treatment and it really can make a huge difference in your face. And what the difference is going to be is you don't have the pucker and it makes your jawline look smoother and more youthful. So thank you for tuning into Best of Both Worlds. If you have any questions, you can always contact us at contourderm.com.
Okay. So that is for the chin Botox. So he injects very similar to me as well. So I just do the one injection point technique and I treat it as a medium muscle group. Any questions on how to do chin talks? Perfect. Moving on. So this is what can happen if you either one under treat or two, the muscle will start to spasm. So when it does this, the patient will kind of call you freaking out, be like, oh my gosh, my chin is doing something crazy. It's just a muscle spasm that it will occur. It will eventually go away, but if it's distressing them, then what you can do is just go back in and just retreat it, and that will help calm it down a little bit faster. Okay, so let's talk about aesthetic record and how to do the stock transfers. So let me show you. I'm going to do a quick stock transfer. Serena, I'm going to do your stock transfer right now to you. So what you're going to do is you're going to log on to the .com of aesthetic record. So I'm going to show you how you do both sides of it. Okay, so you're going to go over here to inventory. And then from here, you're going to find where you need to do your stock transfers at. So you can see where it says stock transfer over in the left-hand side. And you are going to find start a new transfer. Now, if someone has already transferred you product, it will pop up here. So I'm going to show you exactly what that's going to look like. So I'm going to transfer 1 syringe of Kiss to Serena. So I'm going to say from Ann Thompson. Serena did her filler checkoff today. To Serena. Why can't I find you on here?
Lopez. There
There
you
we go.
go.
I was like, I cannot find you. Okay, thank you so much. Okay, and then from here, we're going to say responsible staff. And I was a responsible staff member. And the product I'm going to be sending her is Kiss. I hope I have Kiss in my stock. If not, then. Okay, it's going to make me do it this other way. So hold 1 second. Let me go add it in. Pull it. There we go. So you won't have to do this part. So don't worry about doing this part. This batch ID is 21437. Okay, let's start over. So stock transfer. So I'll select it. That's the batch number I just put in. I'm sending her 1. And then once everything is there, I'm going to hit save. And yes. So now when Serena goes into a static record and she logs on and she clicks on stock transfer, she will see from Ann Thompson to Serena Lopez. She will simply click on details, make sure everything is right, and she will hit confirm and accept. Serena, I'm going to go ahead and do it for you. Are you okay with that?
Yes, ma'am. Thank you.
Okay, perfect. So I gave her 1, and we are going to hit accept. So now she can update her traceability on the patient that she did today. So that is how you do stock transfers. Pretty simple. Any questions about that? Perfect. Moving on. All right, so let's talk about end of the month checklist. So these are the things that you need to do by the end of the month. You want to make sure that you have closed out all of your charts and forward them over to your supervising physician. You also want to make sure that you've signed everything as well. Now, bank drop is something that we no longer utilize, so don't worry about that. And then you obviously want to check your inventory as well. You want to look at your traceability and make sure that your numbers match up to exactly what it shows in your personal stock. So these are the end of month checklists that you should be doing at the end of every single month. There we go. Okay, let's talk about the marketing homework for this week. So this week, what you are going to be doing is you are going to be joining a Facebook group. I highly recommend joining neighborhood Facebook groups. They are a great way for you to start posting about your business. It is very usually women business friendly. So it's something they will usually have like a small business Monday where you can post on there, but it's a great way just to get out of your warm market and start reaching out into your cold market. You're also going to post a before and after of Chin Talks, and I have that graphic for you as always. And then you are going to do one education post about the average cost of neurotoxin. It can be by area, so you can say glabella is usually around $250. Crow's feet is about $150. Forehead is around $140, $150 as well. You can do independent eyebrow lifts. You can do chin talks, some type of education post about the average cost of neurotoxin. What we're really trying to do is to try to demystify patients who are neurotoxin naive and they don't understand the price per unit. They have no idea really what that means. So you're going to start educating your patients on some of those kind of more common things that you need to know once you become a more veteran neurotoxin patient. And then you're going to be continuing your social media following. I picked 3 additional people for you to follow. Again, these are just different groups that I think they do a really good job with educating. It will expose you to a lot of different types of injecting. So please continue to be a sponge and learn as much as you can about the injecting world. There's so much to learn and it's always changing. So I want you to try to be as up to date as possible by following as many people so you can just figure out what type of injector that you want to be in the future. All right, so that is this week's call. What questions do y'all have for me?
I have a question.
Yes, ma'am.
Did you ever find out if I can treat myself in Mississippi or I need to go to Louisiana to treat myself?
So I talked to the lawyers about it, and what they said is technically she has to be in the state where she's treating a patient. But they said also at the same time, who is going to turn herself in, unless she turns herself in, is
That's
what.
true.
So I said, okay, I will pass that on to her. So if you are treating a patient, the law states that you
Right.
must be in that state. I don't foresee you turning yourself in, though.
No, I don't think so.
Yeah.
If
So
we do a procedure on ourselves, how do we chart it?
you chart it just like any other patient. So you have to consent. You have to do all of those things.
Okay. All right. Perfect. Thank you.
You're very welcome. Are you an NP? Remind me.
I
Tara.
am.
Okay, perfect. Okay. All right.
Yeah, baby.
Good. Any other questions? All right. Well, I hope you have a good rest of your week, and we will see you back here next week for week 7. Bye, guys.
Thank you.
Thanks again, Ann.
You're welcome. You did awesome, Serena, today.
Appreciate that.
Yeah. Bye.